Brought to you by GTA, your island, your network.
Guam didn't always have high rates of chlamydia on island. According to data from the Department of Public Health, back in the 1990s, there were only 100 cases per 100,000 people. Now that number has more than doubled, with 600 cases reported in 2018.
So we ranked as the 5th highest chlamydia case rate in the nation.
Vince Uggan, Communicable Disease Control Coordinator 2 and acting supervisor for the HIV hepatitis program at Public Health, helps explain why Guam is on the list of high infection rates.
So our program has actually been doing quite a bit, since we started noticing all of these increases in the STD rates. And mind you, in the nation, the rates of STDs are also increasing. And it could be due to a number of reasons. One of them would be funding. So STD funding has remained stagnant for the past several years. And also some other things that are a little harder to explain include some of the risky behaviors that people are engaging in, and that includes unprotected sex, sex with multiple partners, especially with people of unknown STD and HIV status.
The high numbers may also mean better reporting.
But on the flip side, I also believe the increase in the rates is because we have a better surveillance system this time around. And also we have been increasing the number of tests that we perform each year.
According to Uggan, his department tests at least 120 patients a month, offering free tests at their Manila facility. They also do a number of community outreaches to remove the stigma attached with STD testing. He says testing is key to treatment since most cases involve 15 to 24-year-olds, and chlamydia can have long-term negative consequences.
Females, for example, can get a condition called pelvic inflammatory disease. Also, if people are infected with chlamydia for a long period of time, it could cause scarring of the fallopian tubes, which will lead to infertility.
His team hopes to increase awareness and reduce the misconceptions with STDs, currently attending a nationwide conference on HIV prevention.
We get to talk about targeted testing, and we do have a poster presentation that will be presented at the conference, and that's going to highlight all the targeted testing that we've been doing for the past several years, and it's going to show how we were able to increase the identification of new HIV cases by making sure our resources go to specific groups, to high-risk groups.
Brought to you by GTA, your island, your network.